I'm going to go over the clinical experience concept map. It's pretty simple and pretty straightforward, but I want to make sure that you all know exactly kind of what's being looked for, what's being expected as you fill this out. Now, up here, I think, this stuff here is kind of common sense, right? Patient's initials, put their name on your concept map anywhere, right? Their initials. Age and their sex, right? Height and weight, you should be able to get all this information from the chart. Code status, that means if their heart were to stop, are we going to try to perform CPR? So it's a DNR, do not resuscitate, or a full code. You just put that on there. Allergies, you put whatever they're allergic to. Again, it should be found on the chart, and then you put what the reaction is, right? Let's see, safety isolation precautions. Do they have any safety isolation precautions? If they're on isolation, you put that there. What type of isolation, why they're on isolation. And as far as safety goes, one thing that will be on probably a lot of them that you do will be that they are uh, they need safety for fall, right? They're a fall hazard. Could not come up with that hard word, fall. So if they're a fall hazard, you can put that there. Admission date, that's the date that they were admitted to the hospital. And their admitting diagnosis. And it will say on the chart what their admitting diagnosis is. Now, other diagnoses are right there, right? So if you take a look at this here, on their admitting diagnosis, you might put on there that they are in heart failure, right? And then down here for other diagnosis, you might put on it that they're diabetic, all right? So, or diabetes, probably put diabetes. Provider, then you could circle here if they're an provider, and right here is where you would put either their MD or PA or their advanced registered nurse practitioner. So if they're an NP, then who the RN is taking charge of them on the shift that you're working, and then who is their nursing assistant that they might have or a nurse's aide. So and then over here, diet, right? They might be on a regular diet, they might be on a soft diet, they might be on a low sodium diet. Let's put low sodium. Got a heart failure patient going here. Let's just put low sodium. Feeding tube. If they happen to have a feeding tube, you would put on there that they have a feeding tube. Um, and then what kind of feeding uh, they're getting through that tube. And then TPN, you probably won't have any patients, at least not the first semester. You won't have any patients on TPN, so that probably will be blank. Actually, with a feeding tube and TPN, a real good chance that you won't have anything to put there, but you might. And TPN is total parenteral nutrition, right? That means that they are getting all of their nutrition through an IV. And drains. If they happen to have any drains, like maybe a post-surgical Jackson Pratt drain or something, you could put that right here. Activity. There should be an order there of their activity level. They might be on bed rest, right? So they might be on a bed rest limitation, or they might have up with assistance, right? Bathroom privileges. BRP, you'll see on their bathroom privileges. That goes in this spot here, and you should be able to see that right there on their admitting page. It'll have an area that says activity, and you just put what it says, right? Okay, so when we get down here to this section here, priority concept and exemplars, you can look in your Giddens concepts book and pick a couple of them out, a couple of concepts and then some exemplars that would be examples of something within that concept. And it has to be specific to this patient, of course. So in this patient here, well, I've already made up that we got a patient up here with heart failure, right? So you got your Giddens book, concepts for nursing practice. This is the second edition. You probably have the third edition. Set up pretty much the same though. And if you look in this first page here, and if you open up the cover here and just look inside the cover, you have all of these concepts. right? And then you can see all the names of the different concepts that you can use. And that's all that you got to put on there. In this case here, the concept of perfusion. You got a heart failure patient, so this concept right here of perfusion would work for wonderful. And then right below it, gas exchange. Right? I'm not going to make this any harder than it has to be. Those two right there, concept perfusion and gas exchange. Your reason for perfusion, or an exemplar that you can use for perfusion, would be, let's see, a good example, heart failure would be heart failure. Heart failure, that diagnosis is actually an exemplar, and it's an exemplar for perfusion. Right? And then an exemplar for gas exchange, you could put pulmonary edema, right? So that's all you have to do for that part, and you're done. And then below that we have the NANDA, the nursing diagnoses. So you need to have the NANDA approved nursing diagnoses on that. Great book to use on that there is this Ackley. So here is my Ackley Nursing Diagnosis Handbook. Right, so then you see Betty J. Ackley's name up here. That's what we call it, Ackley. Most of these books I go with the author. It's easier. Sometimes names change, but we have an author that we use. If you look right in the front, there's this big list of nursing diagnoses, right? I just opened up the cover, and that's where it's at, right? You got all those nursing diagnoses. See cardiac down here. Decreased cardiac output. See, they highlight or they bold the number that will pull you to cardiac, pull you to bleeding, right? Pull you to fluid, right? Deficit of fluid volume, right? So you got that. So it's kind of easier to find things as you just scan through that. And that's a fast way to pick something up. But I'll show you a really good way to get what you need for this care map. And that is if you open up Ackley here, in the beginning, that first so many pages has this green bar on the side, and when you're in that green bar section, all you have to do is look up what you're trying to find here. So we're going to look up heart failure, and it might be under congestive heart failure. An older terminology was congestive heart failure. They decided to leave the congestion out, the congestive part out, and just call it heart failure, which is probably a better idea. You see H, heart failure, right here. See it? And then look, it's got all of these that are common nursing diagnoses used for heart failure patients. So it's really easy to pull one of these out, right? Activity intolerance, decreased cardiac output, constipation, fatigue, fear, excess fluid volume, impaired gas exchange, powerlessness, risk of shock, or risk for shock, and all of these related to things, right? Readiness to enhance health management. So let's go here. We decided to go with perfusion on there. Let's stick to that same kind of theory. I think it'd just be a little faster, makes sense on our thing. So I'll look for something here. And I'm seeing this decreased cardiac output. That's the explanation of our concept that we picked. So let's go ahead and use that. Wouldn't have to. We could go somewhere totally different. I might have fatigue. We might want to cover that, right? You might, if you want to get 4 different things, you could use 2 of them, 2 off of the exemplars, and then 2 nursing diagnoses that aren't related to the exemplars. That they're all related to the patient and the patient's heart failure, but but in this case, I think, and as long it depends on what your nursing instructor will want. If I was your instructor out there, I would just tell you to go along with 2 that are close to the same, unless you want to explain 4 different things. So this makes it pretty easy. So we'll take decreased cardiac output related to impaired cardiac function, increased preload, decreased contractility, and increased afterload. Now, you can use all of these things. You can take some of it out if you think that some of it doesn't fit, because there are different kinds of heart failure. There's diastolic and systolic failure, right-sided, left-sided, but the diastolic and systolic might not it might make it so some of these are good examples, but I'm going to say in ours we'll use that whole thing. They have impaired cardiac function, of course, that's why we're saying that they're in heart failure, and increased preload. In other words, if they have fluid overload, their heart muscles are being stretched, right? They're being stretched out, and because there's too much fluid in the system, so too much fluid is returned into the heart. And then you have decreased contractility, right? Ron, we always talk about Starling's law. When you stretch something out more, right? You take it and you stretch it out more, and it shoots. You take it, stretch it out even more, and it shoots harder. Well, in this case, they're stretched out more, but they're being stretched out chronically. So if you take a rubber band and you put it on a peg here and put it way over here and put it on a peg and leave it there, it loses its strength over time. And that's what's happening here. They're stretched out for too long a period of time. The heart gets boggy and loses its force. So that's what we're going to say is happening. So in this decreased cardiac output, we're going to say they have an increased preload. That means that too much is in the heart. Preload is what fills the heart before it pumps. And decreased contractility because of the decreased preload, and then increased afterload. In other words, with this fluid volume excess, the heart's beating here, and what it's beating into, the body, is already full of fluid. So it's pushing against a lot of pressure, right? So you guys probably got really high blood pressure with this. And it's just if or not, if all the circulation is too sluggish, but probably is. But anyway, so they got an increased afterload. So that there would be a good NANDA nursing diagnosis, and we need 2 of them for your paper. So the next one that I think would be a good one is impaired gas exchange, right? That goes right along with our gas exchange one that we picked for the concept. So impaired gas exchange related to fluid and interstitial space of the lungs. So fluid in the interstitial space of the lungs. That's pulmonary edema, right? Swelling in the lungs. So impaired gas exchange related to excessive fluid in interstitial space of the lungs. So we've got the 2, right? And as you can see here, when you get specific with your patients, you might really want to grab one of these other ones like fatigue or fear, something that you know specifically about your patient that would fit in the nursing diagnosis. But anyway, remember, I found that here in Ackley in the part with the green bars, and you found it right here, right? And that's a great way because it gives you your diagnosis and you're related to right there. And then you're related to as long as it works for your patient. Right, so we decided to use this activity intolerance. So you can come back in here. You found it here by looking up your disease, and you found that. And if you want more information on what that is, you can look it up back here. Now, what did we say? Decreased cardiac output. Right? You got decreased cardiac output we found here. And defining characteristics. Altered heart rhythm, altered preload. And then over here, it gives you an explanation of what heart failures is. Examples of outcomes with indicators. You could say that the client will, right? This is your outcome or your goal. The client will have adequate cardiac evidence as evidenced by blood pressure, pulse rate, and rhythm within normal parameters for the client, right? So that way you're saying it. And then you kind of want to say by when. Well, if it's a short-term goal, this is what you want. They will have that happen. This would probably be a better long-term goal. We want, and as evidenced by the normal parameters of the client, strong peripheral pulses, maintained level of mentation, lack of chest discomfort or dyspnea, and adequate urinary output, an ability to tolerate activity without symptoms of dyspnea, syncope, or chest pain. All right, so here's some good measurable goals that you could use. And then down here you have some interventions that you could use to try to get those goals. So when you look up in here and you pick out a goal here and you think, oh, this will work for my client. Now, if you thought of one, go ahead and use the one you thought of. You don't have to go through all this. If you're having a hard time trying to think of a goal, just come on up here, pick one of these guys, and come down here and see what you can do about it. Right? So the nursing activities, right? So recognize characteristics of decreased cardiac output. So monitor and report presence and degree of symptoms, including dyspnea at rest, reduced exercise capacity, difficulties with activities of daily living. So see things that are showing that they're getting worse, right? Orthopnea, paroxysmal nocturnal dyspnea. So when they're losing their breath every time they lay down, it's something to report. Cough, palpitations. They start palpitating. That's their heart beating irregular, including jugular vein distension. So if you see that that's really sticking out, that's something to report to the nurse. Peripheral edema, right? And S3 gallop. Now you hear the lub dub. If you hear that, lub, sounds like a gallop. Lub dub dub, lub dub dub, lub dub dub, lub dub dub, right? Then it's abnormal. Wouldn't really expect you to catch that right now, but if you do, that's awesome. So those are signs consistent with heart failure. So monitor orthostatic blood pressures, oxygen, hemodynamic values, and daily weights. Daily weights is an important thing that you're going to monitor. So that tells you, are you getting rid of fluid, or is he still accumulating fluid? These interventions assess for fluid volume status. So see, there's all kinds. I'm not going to read the whole book to you, but there's all kinds of stuff, right? Apply graduated compression stockings or intermittent sequential. So if one of your goals was to decrease the pedal edema to a +1 edema, it's a +3 now. So then you're going to say, okay, I'm going to apply compression stockings or intermittent sequential pneumatic compression, right? So that's something you can do. It's something else in here. Just go boom, boom. What's this? Observe for and report chest pain or discomfort. Note location, radiation, severity, quality, duration, and associated with manifestations such as nausea, indigestion, or diaphoresis, right? They get all sweaty. Also note precipitating and relieving factors. Chest pain discomfort may indicate an inadequate blood supply to the heart. Okay, so you get all this stuff here. So this can give you a reason that you wouldn't be doing them, right? Monitor pulse oximetry and administer oxygen as needed per healthcare provider's orders. Supply oxygen, increased oxygen availability to myocardium can say, so this is why you're doing it. Supplemental oxygen increases oxygen availability to the myocardium and can relieve symptoms of hypoxia, right? Here, provide a restful environment by minimizing controllable stressors and unnecessary disturbances. Reducing stressors decreases cardiac workload to the oxygen demand, right? You're decreasing the sympathetic response, giving the rest and digest response a chance to take over. So that's what you're doing here. Provide a restful environment. That's a pretty easy thing, and you can do that with a heart patient. It's a great nursing intervention. So really, probably you can get a lot of the information, maybe all of the information you need for that out of your Ackley book here. Another book, if you don't have interventions and stuff, is this one here. It's written a little bit heavy, a little hard to read, but you can definitely find things that you're going to need out of this book. If you look up heart failure in here, it's going to give you everything you need. Problem is in first year you might not understand everything that you're reading. Okay, so we can get back to our care mapping thing here. So let's come on down here, and now we're going to go ahead and I'm going to say for a concept, perfusion. right? This is a priority concept, a lack of perfusion. So I would put perfusion there with the exemplar heart failure. And then below there, I could put gas exchange. Right, there's going to be a gas exchange problem, and the exemplar could be pulmonary edema. Right, and both of those are things that cause the problem with that concept in a person with heart failure. Then if I come on down here, that little period that don't belong there, you come down here and you'll pick a NANDA approved nursing diagnosis. Go ahead and look in your Ackley book. Okay, so we decided to go with decreased cardiac output, and with these here, NANDA approved nursing diagnosis, you always want to related to, are related to impaired cardiac function, increased preload, decreased contractility, and increased afterload. Now, all of these, this doesn't need to be, I don't think that needs to be in bold. Better if it's not. And you know, we really don't need this stuff here, right? Just takes up space. So decreased cardiac output related to impaired cardiac function, increased preload, decreased contractility, and increased afterload. So if you take a look at that, right, what are we saying there? Decreased cardiac output, right? Well, that makes sense. And it's related to impaired cardiac function. Your heart isn't working right. That's why you're in heart failure. Increased preload. It's because you have fluid volume excess. You're not perfusing your kidneys well, so you're not getting rid of urine. Not perfusing your kidneys causes your kidneys to release renin. Release of renin is, of course, activates the renin-angiotensin-aldosterone system. And if you're familiar with that, you realize that that just compounds the problem of excess fluid. So, and then decreased contractility, which you have with a heart failure. That is usually the problem, is that you don't have the contractile force that you need. And then increased afterload. So when you have fluid volume excess, you are having to push into all that fluid. That's your afterload, what the heart has to push into in order to function. So that there would be your NANDA approved nursing diagnosis. And how did I end up with that? This is supposed to be, okay, that was one. And approved nursing diagnosis. I'm not sure. I think I messed up my paper here. So anyway. Oh, that's what because when I did that, I should have left that the way it was and put one here. And now this down here is 2. So now another one here that we looked at when we were looking at the book, we decided to go with impaired gas exchange, right? And this here kind of goes along with what we decided up there on the top part that I didn't type in, but we decided looking at the Giddens book what we would pick. So right here, increased, no, I already did that. So up here, we've got impaired gas exchange related to impaired gas exchange related to excessive fluid in interstitial space of lungs. Not interspatial, interstitial space in lungs. And that's saying that you've got excess fluid in the interstitial. Something wrong there. Okay, the interstitial space in the lungs. That's saying the same thing pretty much that we had up here. And I don't mind if you end up saying the same thing that you said up here. In fact, I think it's okay. You're just saying it with two different forms, one of them using the nursing diagnosis and the other one using the Giddens. Now, you may have an instructor that tells you that they want you to have different things, address different problems, and then that's what you would do. And you wouldn't pick the two that I picked. I didn't put them up here at the top for our Giddens concept. So up here we'll go perfusion, exemplar heart failure. And then down here, we said gas exchange was the perfusion, or was the concept, gas exchange. And that there, the exemplar is pulmonary edema. And again, I've got all this stuff here bolded. I didn't take the bold out of here, so it's got to be Control B. Okay, so that's how you fill out that section. And I guess to make that look a little bit better, I could kind of tab that over. And then the rationale. You want to put why you chose those things. In heart failure, the priority problems are related to decreased, say, cardiac output and or decreased cardiac output. And I'm going to go ahead and go like this and put decreased perfusion. Right, those two kind of go together. Impaired gas exchange related to fluid in the lungs. And just go ahead and put here a pulmonary edema. Maybe it looks better not bolded. I don't know. I guess you could leave it bolded if you want. It's not a big deal. So now down here, subjective data. Right down here in the subjective data are things that the patient tells you, right? Things that you don't really, that you're not observing, but the patient tells you. Let's say the patient says, I get short of breath every time I try to go upstairs to bed. All right, so if he says that, and then you put that in quotes. And here's the thing. A lot of quotes, a lot of quotation marks in subjective data. If you use that, make sure that you are quoting exactly what the patient said. You're not paraphrasing. If you're paraphrasing, you cannot use the quotation marks. But if you know exactly what they said, it's a really powerful statement when you put it there in quotation marks, and you know that that's exactly what the patient said, and that way the next reader can read it and interpret it the way they would interpret it, right? Instead of when you play that game when you're in school where you tell somebody in the front of the row a certain thing, and then that person tells the next person, that person tells the next person, right? Interpretation, whenever something is due to interpretation, it changes, right? Like I was saying in that game, you tell this person, they tell the next person, they tell the next person. By the time you get to the end, you got a story that's totally different than the original story. And here, if you can actually put something in quotes, each person can interpret exactly what the patient said. But still, it's a good way to do it, right? And then the pain or the patient denies pain, right? Denies pain, right? You could say denies chest pain, but if they just deny pain, then that's good. Now let's say they have a pain in their ankle. They got arthritis. Then you could say the patient denies. Let's pretend that the patient has arthritis. And then we got to come back up here, right? Put that up here if we want this to make sense. This thing here, and let's say it's osteoarthritis. Osteo. Right? So we're going to come down here and we can say the patient denies chest pain, does verbalize joint pain. You could say, and then in quotes, maybe he said, but that is always there. Right, so then you know that that's not a new thing. Or you could say denies new joint pain or any new pain or something like that, just to let them know that that's a chronic pain that's there, but they feel it. But that's your subjective data. And when you come over here in objective data here, alert and oriented to person, place, and time. Now you could just say alert oriented times 3 too. Then you could say moves all extremities with bilaterally equal. Right now, if one hand grip is stronger than the other, then you say that. But we'll just say this guy here has got strength bilaterally equal. And then you want to say something about their face, right? Features are symmetrical. Respiratory becomes dyspneic when sitting up at bedside, recovers breath in 30 seconds, right? So in other words, when he sits up at bedside, he becomes dyspneic, but it takes him about 30 seconds. So becomes dyspneic when sitting up at bedside, recovers breath in 30 seconds. So that says that when he sits up, he gets short of breath. So that's showing you that just not a whole lot of activity makes him get short of breath. Is able to converse in multi word sentences when at rest. All right, so just showing that at this point, this patient, when he's at rest, he's at least able to converse a little bit, but he's not able to do much. He tries to sit up at the bedside. He can't really do it without becoming dyspneic. Now we're on the respiratory, so now we got to say what his lungs sound like, right? Lungs with bilateral crackles in bases. That kind of be what I would expect to find on a patient here with heart failure. That you'd have bilateral crackles in the bases. They have dependent edema. Whatever is low is where the water goes, right? And so that's usually in the bases. Cardiovascular, I'd say, let's say his heart rate is 96. Heart tones are muffled. let's say that this guy has a murmur, because maybe he's got a mitral valve prolapse, and that's the problem that he's got. So you would just right here is you would chart that. You would say murmur auscultated at the site of P pulse and maximal impulse, right? You know where that is, right? So, and that would be indicative of a mitral valve prolapse. Now, you wouldn't have to put that if you're not comfortable putting that where you hear it best, but you can say that it's auscultated there because that's where you should be listening to your heart tones. Now, also here in the cardiac section is where you probably want to mention capillary refill, rapid cap refill, sluggish cap refill, cyanotic nail beds, cyanotic mucous membranes, right? That can be in the integumentary system area. It can also be here in the cardiovascular system area. Actually, by rights, it should be in both spots. Musculoskeletal. Okay, I'm going to put in here that he has bilateral pedal edema, deformity of fingers with history of osteoarthritis, right? Edema. Yeah. Gastrointestinal. We are going to say if this guy's stressed, you could kind of almost assume that he might have some hypoactive bowel sounds. Bowel sounds auscultated every 45 seconds in all quadrants. Right, so all four quadrants you're hearing bowel sounds, but you hear them in takes about 45 seconds. So that's hypoactive. Should be hearing them in less than 30 seconds. Genitourinary. Patient's urinary catheter displays, let's say clear yellow urine. So that way you know that that the guy has a catheter. And I got a T in urinary, so let's go ahead and fix that. Patient's urinary catheter displays clear yellow urine. And we don't have to put how much is out because we're going to do that down here in the fluid intake and output. So now, integumentary. So we're taking a look at their skin here. Okay, so in the integumentary system, that's just your skin. General color you can look at, right? Any kind of cyanosis, whether it's cool or warm, things like that. Any kind of cuts, sores, or anything like that. If they happen to have an IV in, you might want to mention that, where it's at. But bed sores, a definite thing that you're going to mention here. Any kind of discoloration due to maybe cyanosis distal to a sore, something like that. So that's what you're going to put there in integumentary system. Skin is, no, we're not going to say he's cyanotic. We're going to say warm and pink, so that's a good sign. But with SLUGG, sluggish capillary refill. All right, so Now they might be a little bit cyanotic. In all honesty, probably this patient that I've been describing here will not display cyanosis. Might have kind of a grayish color and off color to them. But we're just going to go ahead with pink, warm and pink, because then I don't have to go through too much more with this guy. Let's see, but his sluggish cap refill, you could kind of expect that. We got up here that he's got a perfusion problem, so you can expect that. Mucous membranes, let's say now he's got a lot of fluid in him, and we're giving him fluid, but we're going to say they're dry. Let's start with the color though. Pink and dry. Now sometimes their skin will be nice and pink, but they might have some cyanotic lips or some cyanosis noted there. Now they're dry and they should be moist. That's common here. Even though the person's in fluid overload, a lot of times they'll have dry mucous membranes, and especially when you're giving them some Lasix, which they usually would be getting. Fluid intake and output. Now when you're in this one here, you should be able to find everything in the chart, right? How much they took in when they ate their lunch tray, all that stuff needs to be added up, all of their fluids. How many Jello counts as fluid, right? Ice chips, I believe it's half. If they had a cup of ice chips, it's a half a cup. I'm not sure. You're going to have to look up your book in that, exactly what the ratio is, but I believe it's half. And water, orange juice, any of that fluid that they took in, you add all of that up and you put it here. So let's say they took in 800. So you put intake 800 mLs. Output. Now if he threw up or something, that goes in there too in your output, right? But we're not going to say he threw up. We're just going to say his output is whatever is in his Foley bag. So you look in there and let's just say it's 1200. And that's probably good because this is a guy that you want more output than intake because that's what he's got heart failure. He's got an excess in fluid, and you're probably giving him medicines that will cause him to do that. Okay, so now down here, let's go ahead and get this started on the next page. Now you're going to have 3 sets of vital signs. I'm not going to make up any vital signs. We'll just say that we know what a blood pressure is. We know what a heart rate is. We know what a respiratory rate is. Their O2 saturation. Now one thing to mention here, if you say what their O2 saturation is, let's say it's 92%. You want to say how it is. On 3 liters per nasal cannula, right? Or you want to put on a venti mask or whatever they have, or room air, right? You put that they're 92% on room air. We're going to say 3 liters on a nasal cannula. Pain, whatever they rate their pain is, whatever their temperature is. So that there all kind of goes without saying it. Hopefully you all can figure that out, and you can see that you got to have 3 recorded vital signs. So you can look in the chart and see what their last 3 were. Meds. Well, let's we can go with ACE inhibitors, or he could be on some kind of diabetic medicine, stuff like that. I'm just going to put 1 down here, and they might be on a whole lot of medicines. I'm going to put 1 down here that would have to do directly with his heart failure problem, and that could be furosemide. All right, so furosemide, and that is a diuretic. Normal dose, we're going to be giving him 20 milligrams. Let's say PO. And no, he's in the hospital. We'll say that we're giving him to him IV. Right? Reason for administration, we're going to say fluid volume excess, right? That's why we're giving it. Nursing interventions, monitor. They're on this here. We want to monitor his potassium level, right? And when you're monitoring potassium, it's probably a good idea to place on cardiac monitor, which he would be on anyway because he's in heart failure, right? Let's see. Lab tests, all of their lab work. You're just going to put it here. You're going to put what their result was. I'm not going to make up a bunch of labs, but that pretty much goes without saying. You should be able to figure that out. You'll find it right there in the chart, and you can see what it is. You can expect to put what the result is, and then reason for the test, right? Like BNP, look for fluid overload, right? Potassium, well, we're trying to see if what their potassium is, right? And so that's why you would do a Chem 7. So every test that you have here, you should be able to state the reason that they did that test and the clinical significance. Come on down here. Treatments, therapies. Let's go ahead here and put oxygen. Reason for the treatment, they had a patient had a low SaO2, right? Low oxygen saturation. Or you know what, better than that. Let's not do that. That's not the way to do it. I just gave you a bad example. You would put O2 saturation of 85% on room air. Right, so that gives you a good idea. If that's what it was on room air, giving them oxygen is a good idea. That's the way you should chart it. And then nursing interventions, teach them the reason for the oxygen, right? You want to listen to lungs. Monitor O2 saturation, right? And spontaneous respirations. And the reason for that is when you put somebody on oxygen, if they happen to have a chronic, low oxygen saturations, giving them a high one might knock out their impulse to their stimulation to breathe. So you want to monitor their respirations when you put them on oxygen, especially people with a chronic problem. This isn't so much the case with heart failure, but it definitely is with COPD. And up here in labs, you could also figure that they very likely will have ABGs drawn too. Let's see, come on back down here. But anyway, any treatments that they have, you might have incentive spirometry. You probably have lots of treatments. You put them down here, right? And you put why they're getting them. Okay, so when you come down here in your goals, your short-term goals or a long-term goal, the patient will, and that would be a long-term. But let's take a look at here your short-term goals first. Patient will maintain an O2 saturation above let's see here with their short-term goals. Just say patient will maintain an O2 saturation above 90 with activity of sitting up at bedside. Right, so we said that he got short of breath when he tried to sit up. Well, here we don't want his sats to drop while he's doing that. Looks like I got an extra D there on maintain, or AD that doesn't belong there. Sit up. The activity of sit up at bedside, of sitting up. Sitting up at bedside. Now I got the extra thing there. I don't know. At bedside. Okay. So that would be one. And so what are you going to do at that? Student nurse will assist patient and monitor O2 saturation while patient is moving to the sitting position. You might want to also teach patient to take several deep breaths before the activity. Right, so they might want to kind of hyperoxygenate before they go to sit up. Keep patient in a Fowler's position to decrease pulmonary edema. Right, so if you can keep them sitting up position when sleeping, that's important because it can decrease the pulmonary edema, right? And make it so, and the pulmonary edema is what's making it so this patient is unable to sit up without. Student nurse will assist patient. I didn't spell assist right. Patient, I don't got that right. Okay, will assist patient while patient is moving to a sitting position. Okay, so you want to say here, patient becomes with activity the exercise of sitting can be accomplished with assist. Let's go to, what was that? Nurse will teach the patient to take several deep hyperoxygenation before activity can prevent hypoxemia, or not prevent, let's say decrease. Decrease hypoxemia with activity. Let's go 3. What did they say there? Keep patient, okay. So sleeping in a Fowler's position prevents fluid build, and that's not what prevents, let's say decreases. Decreases fluid accumulation in the lungs, and that is compared to lying flat. So that's what you're going to put. You're going to put something like that, right? A long-term goal could be patient will be able to ambulate 25 feet to bathroom without assist by November 3rd. See, that's 3 days or something, right? So 25 feet to bathroom without assist. This might seem very unrealistic at the time, but it seems, I think that for this patient, that would be a realistic goal. At this time, he's not even able to sit up at the bedside. So you've kind of got, you can see a short-term goal. What is that? Without. There, I don't know what was wrong with that, but okay. Patient will be able to ambulate 25 feet to bathroom without assist by November 3rd, right? Yeah, we'll stick with that. Patient-specific teaching points, right? So faces, you're going to teach them faces. It's things for them to watch for. The F stands for For fatigue, A is activity limitations. So AC is chest congestion or cough. C, and then we're on E, edema, right? And S, shortness of breath. So if they can remember those faces, letters to those symptoms, that's a good thing to teach. So teach faces, and a big one here is teach daily weights. Right? They should weigh themselves every day. Report a gain of 3 pounds in 2 days. Looks like I got an extra I in there. So 3 pounds in 2 days. They need to report to their doctor. And there's several other things. Any drugs, right? Drugs they will be on. Make sure that they know that. I got, okay. Diet, right? Most likely they'll be on this guy here will be on a low sodium diet. And if they were put on an ACE inhibitor or an ARB, they may be put on a low potassium diet. So, that's just something that you'll have to teach them. That'll go along with the drugs that you're teaching. So that's, patient-specific drugs or patient-specific education. So these are teaching points that you're going to have to try to teach this person with. And right down here you have an S bar, right? So you want to fill this out. And you can fill this out like you are going to communicate this patient's condition to somebody. It does not have to be the doctor, right? You can fill it out like if maybe you wanted to talk to the patient's wife or the patient's spouse, I should say. It could be the patient's husband, a family member. So, or you might sometimes S-bar at Mercy, we had the X-ray techs would want an S-bar when they took the patient. So you'd fill one out and you would communicate the things on that S-bar to X-ray when they went, because they're going to have them down there for half an hour or so. They want to know some things about them, because if something happens, the doc's going to be asking them, and they have to know these answers. So it's a situation. Of course, you put your name, right? Patient's name and reason report. Do not put their name, put their initials on here, and your primary concerns. So what kind of concerns you have about the patient. Now, if you're calling for an order, which is probably what S-bar was actually designed for, you're going to need those concerns. A history, right? So say you're sending them over to X-ray or something, and your history, you can say this guy here has a history of heart failure and diabetes and osteoarthritis, right? That there is what you can put there for their history. Current problems, they had pulmonary edema, and hypoxia. All right, so they got low oxygen due to pulmonary edema, or you could just say an exacerbation of their CO or an exacerbation of heart failure too. But this is a little bit more specific, probably better. And the patient reports feeling more on exertion, right? Vital signs, you put a list of their vital signs down there, what the patient says their pain is, right? Any lab values that are pertinent, like if they have a elevated PO2, you also want to put on here what their oxygen saturations have been running. And this particular patient, that would be an important thing to do. Make sure that, because you want that somewhere on here, because they're going to need to know that. The kind of things that you've been doing, right? So you'll say on here, they've been on oxygen at 3 liters per nasal cannula. Um, increase oxygen to 5 liters with patient activities. So they'll know that they might want to put him up to 5 liters while they have him, right? You might put him on that 5 liters when he takes off to x-ray. And if you were calling the doctor because maybe you wanted an additional uh, order, then you would, what you put in here could be a little different depending on what you're calling for. Now, the thing is the reason that I kind of went with x-ray here, and you can go with a family member, some kind of communication that as a student nurse that you may have to do or that you did do while you were there. It's a good idea to get used to filling these out. Uh, and I did that rather than you calling the doctor because at this point you haven't called a doctor, and I don't want just to make a bunch of crap up for no reason, like pretend the patient got worse, right? I want you to write the SBAR the way that the patient is while you were taking care of them. Now, if they did get bad and the nurse did have to call the doctor, then that's a great time for you to fill out an SBAR of what you would have said to that doctor for the order that that nurse was trying to get. So try to make it fit some kind of situation that you saw while you were there. Recommendation, what I need from you, and that's what you're putting. If you're calling the doctor, you'll say what you were trying to get. A specific time frame. Like let's say that you did have a problem here, and you were calling the doctor, and let's say this patient had an increase in edema, even though they've been getting 20 milligrams of Lasix. You're saying, maybe you kind of would like to, you just say, is there anything we can give him along with that 20 milligrams of Lasix kit, because the patient's pulmonary edema or the patient's symptoms of dyspnea haven't helped yet. Now, the doctor might give you an order for something like albuterol, might give you an order to increase the oxygen saturation, or it might give you an order to increase the Lasix that they're on. That will be the doctor. Now, you're not telling him, I want this medicine, right? You are saying, what I want from you is something to take care of this problem. Like in this case, if they have increased dyspnea, is there something I can give him for his failure to improve with his dyspnea, or for his increased dyspnea on exertion, right? So something like that. Might tell you can increase his O2. Why don't you put him on a venti mask and give him 45% oxygen, right? You don't know for sure what's going on, but you can definitely give this report in a way that kind of lets the doc know exactly what's going on so that they can give you a proper order. And then you also want to say, okay, make sure that you have a time frame. If they say, yeah, give him an extra 20 milligrams of Lasix IV, you say, okay, is that one time now? And they'll say, yes. Or he might say, give him 20 milligrams now and give him 20 milligrams in the morning on top of his regular dose, right? Something like that. So you want to know a specific as to when and for how long. Suggestions for tests and treatments, right? You can say, is there anything, we haven't gotten a chest x-ray on him since his admission. Would you like another one of those, right? Something like that. You might want to do that. Or let's say that they're on this, you started them on an ACE inhibitor and stuff, and you look at this and you don't have any electrolytes in the chart in your labs. Well, you're definitely going to need to call a doc and say, hey, we don't have any electrolytes on here. We get an order for that. So in that case, you would get pretty specific. Doc would be like, whoa, I overlooked that, and I'll probably give you the order for it. So let's move on down here. Okay, here at the bottom, you've got the CUSIN competencies. And these are competencies that have been developed, and we want you to take part in this. Now, you can go to that website there and read about it and see what it's like. But it's a really a pretty simple thing for you to do. You can pick one of these categories here below, right? You can pick the quality improvement, the safety, informatics, patient-centered care, teamwork, and collaboration, evidence-based practice. And if you go to the site, it kind of explains each one of those. But I'm telling you, don't overthink this. Just make it simple. Let's say you picked quality improvement. If you happened to see that they have developed some kind of quality improvement with heart failure, since we're doing a heart failure patient, uh, and recently they have there has been a lot of quality improvement projects going on with heart failure. They're trying to decrease the amount of readmissions, and what they've done is they've kind of made it a policy to encourage home health care nurse to go in for the first week when a person with heart failure has been sent home. And that is to set up one of those home monitoring systems where there's a scale and an automatic blood pressure cuff, the little thing to put on their finger, and a thermometer, right? So they get their little thing on their finger is O2 saturation, and their weight and all of this stuff. All when they every morning when they get up, they get on there first thing, and that information is sent via telephone line to their doctor. Or to the home health care agency itself. And any flags will automatically be triggered and will be addressed. And hopefully this will um, catch an exacerbation before it has gotten severe, and they can go ahead and take care of it before the patient has to go back to the hospital. And safety, kind of the same thing. Any kind of safety things that you witnessed while you were there, you just put safety and then put what happened. A good one here, patient-centered care. Um, I saw one of the nurses one time, or one of the students one time, put on there patient-centered care, and put on there that the nurse had made it a priority and asked the nursing student to get a hold of the priest, because this particular patient, it was more important to him. He was Catholic. It was more important to him that he got the uh, the host on Sunday morning than than it was that he got his Lasix. I mean, that was very important to him. So it got in front of and that's the sacrament, right? So the nursing student got a hold of the priest and made sure that the priest had somebody arranged, or the priest had arranged for somebody to come over that Sunday morning to administer that sacrament to that patient. So I thought that was a really good example there of patient-centered care. But you can find one of these. If you're not sure what they are, go ahead to that site. I'd go ahead and click on this uh, here. And this is the page that you end up with. And so you got those same things right here, right, that you have there. And then, like I'm saying, don't spend a lot of time overthinking this. The rest of this, to me, is more important, right, that you get all the rest of this thing filled out. But you can come here, and this will give you an idea, right? So quality improvement, teamwork and collaboration, safety. Let's click on that one. Examine the human factors of other basic safety design principles, as well as, so yeah, so it kind of gives you an idea of the kind of thing that you would put. Um, for safety, you can put on there patient, it has a bed scale, right? We gave them a bed scale and continually reinforced that the patient asks for assistance when he tries to get up to go to the bathroom or something like that. So that's what you do there with the cues and competencies. Don't overthink it. In fact, you may even have a nurse instructor that doesn't even care if you put it there, or you may have one that's very picky on it. You're going to have to find out what your instructor wants, really. And then this down here at the very bottom, clinical reflective questions. I realize I need to work on. Boom. And you just say what you think. If you think, well, I don't think I felt very comfortable finding things in the chart. So on finding things in the chart, or familiarizing myself with the electronic charts. And I will do this by spending more time looking through the charts and asking questions or something like that. As I look back, I should have spent more time on boom, right? Or whatever you think you should have spent more time on. These here are all, you can't do them wrong, but you got to answer them, right?